Are you ready?
Mm-hmm.
Okay. So for anyone that hasn't met me, my name is Ashley. I'm a student at Northwest Florida in Niceville in their BSN program, and I'm also a nurse in the emergency department at Bay Medical. I did some clinical time here, and one of my course requirements was to come up with an evidence-based practice project where there was a need in our population I identified during my clinical time, and I developed an intervention for this need. So the need that I found was the lack of nutrition in our society, especially in the targeted population that this clinic serves. Whether it was malnourishment or just getting the wrong kind of nourishment. So my project is called Better Nutrition for Bay. My objectives, my cognitive objective was to identify health benefits of a well-balanced diet. So as the audience, that is what you're supposed to glean from this. And the effective objective is to for you to make a decision to take advantage of the resources I've provided for you to give them to your patients. So in our population, there's 174,987 people living in this county. 10.1% are unemployed. 14.2% are considered in a poverty-stricken level, which means they make less than an annual income of $23,000. And there's 160 reported cases of homelessness, which is only what's reported, so obviously there's more than that. So we have a need for knowledge. The U.S. Census conducted in 2010 was the most recent one published when I did my research. And 39% of the population in our county were unaware of the resources that are available in our community, which means that's 52,496 people, approximately. Of these people, the most common medical illnesses and sickness that we see are high cholesterol, high blood pressure, and overweight and obesity. 33% are both high cholesterol and high blood pressure, which is 57,745 people. And 66 are overweight or obese, which indicates that there's 115,491 people in our county alone that fit in that class. So what can we do? Educate our patients, provide them resources, tell them where they can go to benefit themselves in this area. The USDA recommends patients of most health statuses receive 5 to 12 servings of whole grains in their diet, 1 to 3 of legumes and soy, 6 to 9 vegetables, 3 to 4 servings of fruits, 1 to 2 servings of nuts and seeds, less than 2 servings of vegetable oils, less than 2 servings of dairy, and less than 1 serving of eggs, of course limiting their sugar intake. They also recommend that they do daily exercise and drink 8-ounce glasses of water every day, as well as expose themselves to 10 minutes of sunshine to enhance their vitamin D absorption. Hypertension is one of the most common illnesses we see in our society. As you all know, can lead to heart disease, stroke, heart failure, and kidney disease. These patients need to limit their sodium intake, and which is commonly seen in processed foods. Now, this population, being in a more poverty-stricken level of society, will pick up processed foods when they do have money because you can get them 10 for 10 from the grocery store. It's easier for them because they don't have a lot of money. They pick up these processed foods. They think they're getting a good meal, but really if they're heart patients, they're full of sodium. It's not good for their perfusion. Also, they need to make sure they have an adequate intake of potassium. This is going to be their leafy green vegetables. Also mushrooms, avocados, fish, bananas. They also should limit their alcohol consumption and make sure they practice exercise daily. Our cholesterol patients can lead to heart disease, stroke, hypertension, and heart attacks. They should consume less saturated fats. Solid fats that sit out at room and don't change their shape, such as butter, is considered one of these fats they should limit themselves on. They should limit themselves on sugary things such as ice cream, and also fats from meat and red meat, beef fat, pork fat. In a cholesterol type patient, you want them to consume less than 300 milligrams a day if they're a man, less than 200 milligrams a day if they're a woman. However, we as humans synthesize our own cholesterol and don't actually need to supplement our diet with cholesterol, as we already produce it in our bodies. We should teach these patients that they need to eat more fruits and vegetables and whole grain and poultry items, and just more foods that have bright colors to them. Overweight and obese patients can lead to hypertension, heart disease, diabetes, osteoporosis, and some types of cancers. These types of patients need to consume fewer calories from fat, increase their physical activity, and reduce their sedentary behavior. Malnourishment can be seen in this population and can lead to weight loss as well as mental and physical disability, fatigue, and dizziness in certain severe cases. These patients have a lack of sufficient nutrients in their body. They're not eating a well-balanced diet, and they possibly have inability to provide food for themselves. Certain clientele, even during my clinical experience, said that their one meal that they ate a day was when they went to the rescue mission, and that's when they ate was their one meal that day. Also, we need to make sure that the sick patients that have cancer, AIDS, or are getting older are also going to have decreased ability to absorb nutrients when they are eating these foods in their diet, and so it's imperative that they do have good nourishment so they don't get malnourished. So, I looked up and provided 6 different locations within town that not only provide other resources but specifically provide food items, or food stamps to the population. The Beach Care Services will provide food as well as help with rent, utilities, medications, clothing, transportation, and jobs. The Catholic Charities will provide a food bank and a family homeless shelter. The Council on Aging provides meals as well as energy assistance programs and respite homemaker personal care. The Department of Children and Families provides food stamps, Medicaid, and medical assistance for pregnant women. The Panama City Rescue Mission, of course, is open every day, 24 hours a day, and provides food and shelter for the homeless as well as clothing. And the Springfield Community Church, as well as other churches in town, will provide food throughout their food pantry. I've created this resource for you to give to your patients. It has a map on the back with each location numbered and printed out in Bay County. Number 1 being your facility here at St. George's Community Medical Center, so they have like a reference point to where they can go from here. In summation, the clientele that you serve in this clinic, they need help with their health education and assistance on top of the excellent medical care and...
Hold that down here, can't hear you.
Okay. On top of the excellent medical care and medications you already provide to your clientele. The goal of this is to achieve optimal health within the community. Of course, we already do such an amazing job at this clinic, providing the medications, the medical care, the tests we can provide, but also on top of that, if there's one thing I could say, maybe provide them more education on their nutrition, maybe provide them another list of resources they could go. So I hope this has been beneficial. Do you guys think you'll take away something from this presentation? Possibly give somebody a handout for these places if they feel like they can benefit from different food locations in town? Yes?
Give us a bunch by the window in the pharmacy.
Okay, I will do that. Thank you for your time.
Very nicely presented.
Thank you.
Good job.
Thank you.